Hello, welcome to our 7th webinar in the Create Your Future series, Navigating the Maze of Resources. Tonight's presentation includes many valuable resources that help make life just a little bit easier when living with spina bifida. My name is Diane Burns, and I am the Program Manager for the Spina Bifida Coalition of Cincinnati. Jeremy Moses is here with me as co-facilitator and technical consultant.
Hello, everyone.
I would now like to introduce our presenters, Marta Getz and Ann Tapia. Marta Getz is the social worker at Cincinnati Children's Hospital Medical Center. Prior to coming to Cincinnati Children's, she obtained her bachelor's and master's degrees in social work from the University of Cincinnati. Marta has worked in therapeutic foster care and community health before joining the team at Cincinnati Children's. Her CCHMC career has been spent in the Division of Developmental and Behavioral Pediatrics and supporting the Center for Spina Bifida. Ann Tapia serves as the Regional Autism Advisory Council, or RAC coordinator for Southwest Ohio. RAC offers and promotes training opportunities to build capacity and expertise. Prior to this role, her experience includes working with children and families within the child welfare, juvenile justice, developmental disability, and mental health systems. Ann has a Bachelor of Arts degree in psychology from The Ohio State University and master's in social work from the University of Cincinnati. She is a licensed social worker in the state of Ohio. Thank you both for being with us this evening.
Thank you for having both Ann and I here this evening. Tonight, Ann and I are going to present information on supports and resources available to you across the lifespan, including local, state, and federal government benefits, community support agencies, and programs. We will get started with our first poll question.
All right, we are launching that poll right now. Please select the appropriate response and click submit.
So in this question, we are asking, which state do you live in? We serve many families all across the region of the country, including Ohio, Kentucky, Indiana, West Virginia, and some families who travel even further to see us. It helps Ann and I have a better understanding of resources that may be of value to you if we know where you are from. And please note, we also do have handouts associated with tonight's webinar for Ohio, Kentucky, and Indiana.
We've already got 50% response on this. We'll give you a few more seconds on that. All right, we'll go ahead and close right about now. 100% response, Ohio is the overwhelming majority.
Okay, great. So we are going to focus on the Ohio region for our presentation this evening. But as Marta noted, then make sure to take a look at the other handouts as well. So we thought we'd start off with the lifespan approach, looking at early childhood services. Help Me Grow in Ohio is a home visiting program for birth through 3 years old. Families can self-refer into this program, and it's for pregnant mothers or new parents. And each county within the state of Ohio has its own Help Me Grow program, but they're all the same throughout the state of Ohio. The idea is that the Help Me Grow staff will come to your home and help you to look at developmental milestones and really take an approach that's appropriate for the development of your child wherever they may be at that point, and giving you the tools and resources to be able to look at how you move past each developmental milestone through 3 years old. Another program that's very similar but separate is the early intervention services. They work together. So the early intervention team includes a number of different providers, including therapists such as speech, occupational therapy, physical therapy, and then the Help Me Grow home visiting staff as well can be part of that team. And the early intervention team will help you to develop an individualized family service plan, which will have established goals, so that will be different for each family, hence the individualized nature of it, that will help you look at where should you be moving in terms of developmental growth, and come up with a plan for how you move through those developmental milestones. The next step as the child ages closer to that age of 3, they'll help you take a look at enrollment within preschool. And they'll also help you with enrollment within developmental disability services as well, depending on eligibility, of course. But the idea being that the plan that's been in place from 0 through 3 years old can then be linked into the school age system. So preschools can then take the plan and keep moving forward with it and help to think about where is that child within the classroom and how can they be helping to continue to support the goals that the family had identified. In order to self-refer, we've got the link here for Ohio Central Intake or the 1-800 number. I think it's important to note that the state of Ohio moved to a centralized intake system as of August 1st of this year. And so with any new system, there's always kinks to be worked out. And I would definitely encourage you to stay persistent if you are not hearing back or getting the support that you're thinking you should have, because the services then get filtered out into each county. So you should be hearing from somebody from your local county to begin those services. And if you aren't, I would definitely encourage you to call back again and find out where you are within that referral process. And then finally, in the early childhood services step, Spina Bifida Coalition of Cincinnati has a number of supportive services available. There's family support, and you can certainly call Diane for more information or email her for more information. And then also touch points, which are a lifespan approach to help think about what are the different unique needs that somebody with spina bifida encounters throughout the lifespan. And with early childhood being kind of that first step, you can reach out to Diane to get more information on that, but that is in partnership with Cincinnati Children's. We mentioned developmental disability services as one of the pieces that can be linked through the early intervention services. So we thought we might just give kind of a broad overview at this point about what does developmental disability services do and what might you be able to access by linking with them. So each state has its own specific set of services that are offered. And the county they're not a service provider. Their role is really to be a coordinator of services, so helping families to get linked to service providers within the community. So within Ohio, there are 88 counties, and each one has its own local DD, Developmental Disability Board. And the eligibility really begins by you making a phone call, and it needs to be the parent or guardian of the child, or if you're an adult, then making that phone call for yourself to begin that intake process. Schools can certainly help with that. So if you're in the school age already, then the school team can certainly be part of that intake process and helping you to think about what are the pieces of information that you should provide through that eligibility process, but really it's the parent who should begin that process. We have a handout. The state of Ohio will kind of spell out a bit more about what that looks like, so make sure you look at that in terms of how to begin that process and what all are they looking for. It's broken down by age, so again, depending on what age that referral is being made, the will be different in terms of what DDS is looking for eligibility. The biggest piece of it, though, is that there is a diagnosis that qualifies for developmental disability services, and then the other side is functioning ability. So thinking about in what ways does the diagnosis impair or limit the daily functioning. So we always encourage, Marta and I have talked about that it's a good idea to go ahead and reach out to developmental disability services, even if right now you don't think that you would need any services that they may coordinate with you, because things change, circumstances change in the future, and having the access to the services is just a good idea, regardless of where you are today. You may have heard that there are a lot of wait lists in terms of waiver supports, and that is true. It's a very, very long wait list to get on with waivers. However, depending on which county you live in, because it's funded locally, there may be different levels of support that can be provided and services that they can connect you to outside of what the waiver would provide. So it's a good idea to reach out and just see what you're eligible for, and then to have a person that you're connected to. Usually it's a service support administrator is what that person's title is called, and they provide case management types of services. And so that person is kind of overseeing your case and thinking about what services to connect you to. Some of the other services that they might connect you to could include things like respite, residential services, day services. Really just kind of depends on each unique need and how they might be able to help you fill that. Okay, so we are going to move into poll question number 2, where we're starting to think about school age.
All right, and we want to know if you or your child have school services, so please, once again, select the appropriate response and click submit. And we'll give you about a minute.
So in this question, we are again trying to get a gauge of the services you currently have or have worked with. So in my experience in working in the Center for Spina Bifida, Cincinnati Children's, not all of our children that we see will qualify for an IEP, but many of the kids do qualify for at least a 504 plan to meet their medical needs in the school building. And some of the information services are different between the IEP and 504, so we just would like to get a little bit more information from you about your familiarity.
Well, we have 2/3 of the response in. We'll give you just a few more seconds on that. But so far, and in fact, we'll go ahead and close that right about now. 100% saying not applicable to them, surprisingly.
Okay, well, that is good to know. I'll still just cover a bit of this information just in case if people who are watching this later want to know this information. I don't want to fly by too quickly. But some of the pieces that we want to highlight are really just that while in school, there may be additional needs for people with spina bifida. The average person, most people with spina bifida score in the normal intelligence range. However, I'm not sure how many of you watched the executive dysfunction. That is a huge component to be thinking about in terms of supports that might be necessary within the school system. So definitely take a look at that webinar within this series as well for some more kind of descriptive components about what executive functioning is and how the school might be able to support in that area. The big piece that we want to make note of is that when requesting supports within school, you should always do that in writing and detail out what your concerns are. So whether that may be the attention, the organization, the ability to complete tasks, be clear in what your request is for when asking for supports in the school environment. And then the school will have 30 days to be responsive to that request. And the first step within that is to begin by having an evaluation, which will determine whether or not your child qualifies for supports, whether that's a 504 plan or an individualized education program. And from there, a team will be developed and the results of the evaluation will be discussed with the family and the student, depending on whether or not that's appropriate, and the guardian certainly has say into whether or not the student is part of that discussion. But then if it is deemed necessary to have some additional supports in place, then either the 504 plan is written, which spells out what kinds of accommodations can be provided for the student, or the individualized education program, or IEP, is developed, and then those are both updated on an ongoing basis. So we definitely would encourage you to explore that if that's an area of need, and make sure that your team is there to support you. So the team, in terms of who should be part of that, should include your educational system, including your general education teacher and any intervention specialists. Outside providers should also be part of that team. So if you've got occupational therapists, speech therapists, any of your other outside providers that are working with your child, they have their plans that can certainly be incorporated into the school plan. And as much as possible, we want to have one single plan for our children that we're working with. So bringing in all of those team players is really helpful to be sure that the plan is really meeting the needs of your child. And then it's also important to have some natural supports in place as well. So if you have, other family members, friends who are caregivers, or neighbors who are just really active in terms of your child's life, it's nice to have those additional supports in place, thinking about how do we really have a good supportive team for your child, and that the educational supports are there. So building that team is really important to make sure that the needs are met for your child. We've included some resources there. The Ohio Coalition for the Education of Children with Disabilities, Parent Mentors of Ohio, and the Ohio Department of Education, with the state support team, who has a parent mentor as well through the state support team. So on the handout for Ohio, you'll see links for each of those contacts. So I would definitely encourage you to take a look at that handout, to reach out to them for more support, and your school and the development of your IEP, as well as any other resources that you may need along the way. Also want to give a plug for the school team that just happened last week. They provided some really great resources as well. So take a look at that webinar if you haven't already participated in that one as well. And then finally, the Spina Bifida Association has really helpful info sheets that you can provide for the school team. So you have to keep in mind that the school team is going to be serving every single student, whether that's a student with disabilities or not, and they may not know about spina bifida. So bringing in your education and understanding both on that general level of what is spina bifida, those info sheets can be really helpful. And then of course, tailoring it to what does it mean for your child, and helping them to understand what are the unique needs of your child in particular. So we've got the link there, so you can take a look at those info sheets and provide that to your school team also as you begin to think about what's the plan and how can you help educate the school team. At this age, it's also really important to be thinking about social connections. So as early as possible, thinking about how can you have your child connected to programming, natural supports, any ways to build some social networking for your child. So Spina Bifida Coalition of Cincinnati, again, has some great programming available, and would encourage you to take a look at their website. There's a long list of resources. We also provided as one of the handouts a long list of both day camps and recreational opportunities in the Cincinnati area. It'll give you just a brief description and then either website or phone number for how you get in touch with those, on a wide range of different types of activities. So, really trying to meet the needs of a lot of different interests and opportunities. But really the big piece in this is beginning to think about how can you begin a network for your child. And the other resource, of course, is Tim Voigt's webinar on social networking, where he provided some really great social, ideas on how you build social networks for your child as well. Okay, we are going to move into poll question number 3.
Yep, and we have launched that already. For the adults participating in the webinar, are you currently working in the career you dreamed of when you were 14 years old? I know for me personally, I am not yet. We'll give you about 30 more seconds to do that.
So on this question, we're really trying to get at, as people transition into, out of the school age and into adulthood, we have to think about what does that plan look like, and how do we help have some successful transitions for people. So students within the IEP system are beginning to think about transition at age 14 formally in that IEP. And so really it's hard to figure out. I think a lot of families are just looking at day to day and how do I get through the next moment, rather than thinking about what does the next 5 years or 6 years look like for my child. So it's a tough question. And especially when we think about the dignity of risk, because we know that a lot of times at 14, we can have really grand ideas of who and what we want to be when we grow up that may or may not be realistic. So it's hard to have that balance between a dream job of something that you want to be doing and that your child wants to be doing, and how do you encourage that, but then also not set them up for failure, which then may lead to, huge disappointments or confidence adjustments in the person in terms of what they're willing to take risks in doing later in life. So it's a tough time and a tough question to be asking, but the reason we're asking is to really kind of get at things change over time.
Yeah, and it looks like the majority are with me, and that no, they are not doing what they thought they would be doing at age 14. So I'm not alone, and I'm certain there are others that won't be will be right there with us as well.
Exactly, Jeremy. I am in the same boat. I wanted to be a marine biologist when I was 14, and then realized that I wouldn't be able to live here in Cincinnati, for one, and that it requires a lot of science that I'm not necessarily very good at. So it took some adjustment in terms of who and what I dreamed of being. But regardless, age 14 is when that IEP team is really beginning to think about it. And from a lot of research, it shows that the earlier you begin having these conversations and thinking about and planning for what the future looks like, the higher success rates that people have. And that's with disabilities or without. So while it's tough to be thinking about, it's a good idea to begin doing those things. So one really important resource that we have in our area is the Transition Boot Camp. Transition Boot Camp this year happens on October 27th. It'll be at the Sharonville Convention Center, and we've got a link here. This has been an annual event and is actually the 7th year that this has occurred. So more than likely it'll continue to occur on an annual basis. So I've also included on here the website for USAID, which is where that next, if it's 2018 when you're watching this, you should be able to access the next year's event as well. So the idea of Transition Bootcamp is to be kind of a one-stop shop to gain information about what are all of the many, many things that I should be thinking about as I plan for transition. It's the kind of thing that really it's never too early to begin thinking about transition, and it's also never too late to be thinking about transition. So whether you're 14 or your child is 14 or your child is 19 or 20 and still within the school system, it's a great resource to utilize to think about. The other nice thing, because it's a jam-packed day of a lot of information, a lot of inspiration for families as well, but you can't go to everything. It's a single day with multiple breakout sessions. So what is offered throughout the year are booster sessions on most of the breakout session topics so that you can take a bit of a deeper dive on each of those topics. So some of them, for example, might be guardianship, estate planning, community integrated employment, and then on those breakout sessions, those will happen monthly throughout the year, where you spend an hour and a half to 2 hours really thinking a lot more about that topic, and those experts in the field are going to give you resources and tips on how to walk through that. So it's a great resource to think about. But thinking about transition, there's a lot of layers to this. So as I already mentioned, the IEP, at age 14, you're going to begin planning and writing up a formal plan for what does that mean. The earlier you begin thinking about it, soft skills are incredibly important. So helping to develop some of the skills that are really necessary in the job, but aren't necessarily directly taught. So for example, your social skills, reading what it means when somebody's engaging with you and kind of stops paying attention. For some, that's not something that's easily picked up on. Or even some of the other skills around dress and hygiene and accessing your transportation. So some of the skills that can be worked on early on that don't necessarily have to do with that end goal, but are just good to know along the way. So those are some of the things that can be started early on. Some of the other ideas to be thinking about as you transition are community employment. We have the Employment First initiative in Ohio, which encourages everybody to have community integrated employment, regardless of what limitations or disabilities or just in general for everyone. Everybody should have equal access to community employment. Now, of course, not everybody wants the same type of job, but the idea is that everybody should be able to access it. So opportunities for Ohioans with disabilities, that is one resource that's available. And they've partnered with a lot of the schools in our area to be able to be providing support to the school systems as they think about transition. Other important step to be taking now is looking at what are the natural supports that you have that might be able to lead to volunteer opportunities. So for some, that may be through faith communities. It may be friends that have businesses that are willing to let your child, help with vacuuming in the evening, or just kind of light housekeeping. Just any kinds of relationships that you already have that you can be thinking about what can build some of those job skills that are just teaching the basics of, I'm supposed to be here at a certain time and I have these requirements while I'm here, and this is what somebody's expecting me to be doing through just volunteer opportunity. Financial planning is another big topic to be thinking about through transition. We'll talk a bit more about this in a few minutes, but as we think about transition is a time to really be thinking about what does it mean as you hit that magic number of 18 when things change, and your child officially becomes an adult within legal systems. So financially, what does that mean for your child, and what are they setting up for future planning? So we'll talk a bit more about what all those resources are in a bit. And then healthcare transitions, which again, we'll talk about a little bit as well, but in a little bit, but really thinking about, have you started to begin planning for moving from pediatric care into the adult system? And then the final piece that I wanted to touch on in this topic is guardianship and alternatives. So there are many different options. For some, the natural choice may be to take custody and go through legally to be able to obtain guardianship. For others, that may not make the most sense. And so there are a lot of different options, including obtaining healthcare power of attorney, so that if the person becomes sick and they're not able to make choices for themselves because of just health needs, then there is a custodian who can step in and help to make some of those healthcare decisions, but otherwise the person is still their own guardian. So there's a lot of different options, and I'm really just giving a broad overview. Would definitely encourage you to look at some of the resources in our community in terms of guardianship and alternatives to get a much better explanation in that area, but definitely something to be thinking about. And I think a lot of times families don't realize that at 18, that guardianship, it's that the child is their own guardian at 18. And so the health system, the school system is all going to be looking to the person in terms of making decisions and signing off, and even in terms of reporting for information that you may be accessing, they may not be able to give that to you. So something to keep in mind as you get closer to that magic number of 18, and thinking about what makes the most sense. Another important piece on this is just that if you do apply for guardianship and it's awarded, it's really, really difficult to reverse. So that is why there's currently a really big push to think about what are the other alternatives, because at 19 or 20, things may look very different than at 30 or 40 years old in terms of the types of decisions and how that person is going to be making decisions for themselves. So it's a complicated decision to be making, but certainly something that should be thought about, and exploring those resources to help you make those decisions. Okay, and moving into adult services. So some important pieces to be thinking about, again, continuing social connections. So as a person ages out of the school system, that natural support network often goes away. The friends that you had at school, if you haven't stayed in contact with them, you're not going to see them every day anymore. So in what ways can you continue to have social connections, hopefully keeping in touch with those school friends, but then what other clubs and groups and organizations can you connect to that meet your interests and your needs? Linking to appropriate medical care. Again, we'll go through a bit more about how there are supports to help make that transition. But that the pediatric system isn't going to be able to maintain medical care throughout the lifespan. They're pediatric, and so who are the adult providers that can be helping to continue that medical care and have a continuity of care over the lifespan. And then involvement in the workforce. And again, I would want to plug the Transition Boot Camp as a great resource in thinking about those adult services as well and planning for as you move into adulthood.
So now, as we've kind of moved from birth to adulthood and the resources and services available in the community, we also want to touch base on some of the other resources that are often come up, especially that I see working in the Center for Spina Bifida. So many questions I get in the clinic are regarding financial resources. Obviously, having a child with spina bifida and other special needs means there's more medical visits, medical equipment, therapy needs that typically developing children may not need. So there's a lot of stress that can come with paying all of these medical bills. So we wanted to touch base on some of the large medical financial resources. So the first thing would be Medicaid. So Medicaid is a household income and size determinant. It looks at money. If you look at our financial handout that we created, you'll see a grid that does kind of label out, if you're an adult, how much money can you make per month and receive Medicaid. And you'll see that in Ohio, it's broken up by adults, families, pregnant women, a child with insurance, and a child without insurance. And the financial income is different for every category. So Medicaid is not something that is user-friendly and easily understood. It's all about percentage of poverty level, but that information is on that grid. And that it did come from the Ohio Medicaid website, but those numbers are accurate for basically the continental United States. The numbers are a little bit different if you're in Puerto Rico, Hawaii, or Alaska, because of cost of living is a little bit different in those locations. But some children can have Medicaid as a backup insurance. So if a parent is working, it is still possible that the family may qualify for Medicaid in the home, but it will be looking at household size and income. Social Security SSI evaluates household resources until a child is 18. At age 18, it stops looking at the household resources and only looks at the resources of the individual. Whether or not you as a parent take guardianship at that point doesn't matter. It still just is only looking at that 18-year-old's resources. So SSI I can't provide a grid like I can for Medicaid and say your household size is this and you can only make this much money, because SSI is also looking at resources. So resources can be things that are worth money and can be sold. So they can ask questions about how many vehicles do you own? Do you have life insurance? I've had a family tell me they've asked if they have burial plots. Anything that can be cashed out is considered a resource. So SSI, it's harder to say whether or not your household would income qualify based off of that. So a very helpful resource we have at the hospital are the Family Financial Advocates, or the FFAs. These are a group of, currently they are all women at the hospital who work with families who are what we considered underinsured, which means a family has insurance, but the cost of the medical care is difficult for the family, or the insurance isn't covering all the services that the child needs. The goal of the Family Financial Advocates is to help families find assistance in paying off these bills. So as the social worker, I work very closely with the FFAs. We try to team up whenever we can so that we can help families find some help with the out-of-pocket balance on their medical bills. Any institution, adult institution, medical institutions also typically have a number on their medical bills. So if you are struggling with paying your medical bills, I do encourage you to reach out to that 800 number that's on those bills. University of Cincinnati Hospital also, they do have people who are helping families and adults with those medical costs. So earlier, Anne alluded to waivers and long wait list when we were talking about the developmental disability boards in each county. So these are the 3 waivers in Ohio through our developmental disability, through the DD boards. The level 1, the individual options, often referred to as the IO, the Self-Empowered Living Fund, typically referred to as the SELF. So those 3 waivers are managed by the County Board of Developmental Disabilities. You get on a waiver wait list. The wait list are long, but it's important to stay in contact with your board. There are, in certain counties and under certain circumstances, there may be ways to move up those waiver wait list. We will be honest that waivers are taking priority to individuals who have aging caregivers. So if you're in that situation and you're an aging caregiver, or you're an individual with an aging caregiver and you are starting to talk about, well, what's going to happen next, it's really important to have that conversation with your local board of DD so that they can understand what your needs are and what resources you may be needing if you are in a position where your caregiver is no longer able to care for you. So aging caregivers and caregivers with changes in healthcare status. Yes, Anne.
I can chime in. Right now, the Future is Now series is going on that topic exactly, about aging caregivers and helping you to think about the planning for the future of your person with a disability. They have 2 different series that are scheduled at the moment. So if you look at the Hamilton County Developmental Disability Services website, they can give you some of the details about when those dates and locations are happening. And it's open for anybody. So even though Hamilton County DDS is the one that's hosting it, anybody is welcome to attend those. And then if I can also jump back for a moment on the SSI, Social Security income eligibility piece of it, you can expect that a lot of people are denied the first time around. So if you receive a denial when you go through that eligibility process, know that you'll need to go through the appeals process, and that's very normal. There's a very high percentage of people who are denied the first time around, go through the appeals process, and then are able to be found eligible for SSI.
And so with the waivers, some of the things waivers can help with, so it is funding, and each waiver has a different level of funding. The level 1 and the self have set funding dollar amounts per year. In the individual options waiver, the dollar amounts determined by the individual's need that year, and you have a care plan with your DDS worker where you kind of create your goals and how you want to spend your money. But some of the services that are paid for through the waivers include respite, home health services, day services. There can be some transportation, GPS monitoring, all kinds of different things depending on what the needs may be. But there is a long wait list for these. Some other families may be familiar with the Ohio Home Care Waiver, and this is a waiver that is for individuals who are considered medically fragile. So this waiver provides more nursing supports. So this waiver may provide a nurse who goes to school with a child during the day or provides nursing care through the night, especially if a person requires trach or vent support through the night. It may be a nurse who stays in the home through the night so that parents or caregivers are able to rest. So this one is much more for individuals who have very medical needs, even like beyond like bowel and bladder needs. So that one is determined about medical fragility, and that one's reviewed. Your status of having a waiver is reviewed on a regular basis, and it's reviewed through nursing assessments. On a slightly different note, achieving a better life experience is also more commonly known as the ABLE Act. This is a somewhat recent tax advantage savings account that's been created so that it is possible to put resources away for an individual with a disability who may need services such as Medicaid and SSI in the future. Currently, Medicaid has those income guidelines. SSI is looking at the resources of the home, and the waivers are even looking at asset resources and the name of the individual. So an ABLE account, which in Ohio we call it's a stable account. So if you look for how to set one up, it's a stable account in the state of Ohio, is a way that you can save money that protects the ability to access these government programs, but still allows the individual to have money saved for them. And it can be used for things such as housing, education, transportation. So those are some of those financial resources. And then we have some additional financial resources. So this is kind of the information that I help families with, or the family financial advocates are helping families with, is what to do when you have medical bills that you struggling to pay or causing a hardship in the house. So we often are working with setting families up and connecting them to different grant programs in the community. We've listed here a few of the Unite Healthcare Children's Foundation, which is one of the largest grant programs that we've run into, as long as two local to Cincinnati, Building Blocks for Kids and Pages Princess Fund. So these are some very helpful programs if you are experiencing difficulty with your medical bills. And also, again, please review that financial resource handout for additional information and links to their websites. The Spina Bifida Coalition Cincinnati does have some financial support as well, so you can always contact the SBCC, or if you're in clinic, we can always work on that together. And then also with the County Boards of Developmental Disability Services, they have a program called Family Support Services Program, or FSSP. This is a smaller pot of money that does not have a wait list, but the amount of money is determined by each county. So the dollar amount provided each year varies amongst the counties in our areas. But this can be used for a piece of equipment, an activity, an education program for even family. We've had families use this for all kinds of different needs, and it can be very helpful, and there is not that wait list. Another financial resource that is specific to Ohio is Children with Medical Handicaps program through the Ohio Department of Health. You may know it more as BCMH. And there are 3 BCMH programs that are important for children with spina bifida. The first is the diagnostic coverage. So diagnostic BCMH is only good for 6 months, and it covers evaluations only, but it can be helpful at that initial diagnosis and when a lot of MRIs and renal ultrasounds and initial appointments with physicians are occurring. And that diagnostic does act as a backup insurance to whatever insurance you have. There are no financial guidelines to diagnostic coverage. Ohio Department of Health says every child deserves a thorough medical evaluation at least once in their lifetime. Another program through BCMH is their treatment program. So for treatment eligibility with BCMH, you have to have a qualifying diagnosis, which spina bifida and caudal regression would both be qualifying diagnoses. And there are some financial requirements. The financial requirements are not as stringent as Medicaid, and BCMH does work with you to try to lower your income based off of some of your medical expenses that you are paying out of pocket. And it's important to note BCMH is always a payer of last resort. So that means they're going to make you apply for Medicaid even if you know you're over income. They have to see that in writing in the Medicaid system that you were denied, because they always need to know that they are the payer after Medicaid if Medicaid is available. Another program with BCMH is service coordination. So this is available at Cincinnati Children's, Dayton, Rainbow Babies up in Cleveland, because in our facilities we have coordinated spina bifida clinics. So the service coordination does allow us to have at Cincinnati Children's 2 nurse coordinators who are dedicated and only work for the Center for Spina Bifida. And so all of the BCMH programs end on the 21st birthday, though you may still be seen in your childhood clinic past that age. The financial supports of BCMH do end at the 21st birthday. Other states around us do have similar programs. They're not called BCMH. They have different names. And typically, and including with BCMH, the service has to occur within your state for it to be covered by the program. So this is a very state-based program. And then moving into our medical clinic at the Center for Spina Bifida Children's. So we start working with families once a diagnosis is made. So that does mean the nurse coordinators, myself, Dr. Woodward, some combination of us, along with Dr. Bierbauer and possibly Dr. Vanderbrink, do meet with mothers for prenatal evaluations when they come to the fetal care center. We follow patients in our child clinic, because we don't have a better name for it, until around age 21. Some individuals are transitioned earlier than that based off stability. So we don't ever want to transition somebody from pediatric care to adult care if they're in a period of instability. So that may mean you get transitioned slightly earlier than 21, but that may also mean we hold on to you in that coordinated clinic past your 21st birthday, just to make sure that you're in a good place with stability and that we have linked you up to the adult providers that you are in need of. The Center for Spina Bifida is a multidisciplinary clinic, and we're trying to provide comprehensive coordinated care. So we did put contact information for the 2 nurse coordinators, as well as a link to the website at Children's for the center. So the team is neurosurgery currently with Dr. Bierbauer, physical medicine and rehab comes, urology, including bowel management. And then this is housed in orthopedics, and then this is all housed within the Division of Developmental and Behavioral Pediatrics. So the dietitian, the nurse coordinators, myself, Dr. Woodward, and currently Katie Thoman is the nurse practitioner. We are all members of DDBP, and that's why the clinic takes place in our building. And our goal is that you are there as short a time as possible. I promise that's our goal. And that you get to see as many of your providers at one time. We understand sometimes that doesn't happen. And we are here if you want to talk about that, but that is definitely our goal too. Sometimes we get questions about, like, what is the role of the DDBP person? So what is the role of Dr. Woodward? What is the role of Katie as the provider? It's pretty clear that neurosurgery is checking out the shunt, making sure I don't have a tethered cord, rehab's making sure my equipment's fitting, urology's checking on my bowel and bladder. But sometimes it's confusing about, so what is the DDBP person doing? So really what the DDBP provider is looking at a holistic view of the whole person. So the DDBP provider is going to ask you questions about education, emotional concerns, any social concerns. We get kind of more intimate knowledge, other outside of your medical needs. We really want to know what's going on in all areas of your life. So you'll hear a lot of times, we'll talk a lot about IEPs, we'll talk a lot about school, we'll talk a lot about how are you as the child or patient with spina bifida doing? How are your parents doing? How are they coping? Do you need linked up to services for any emotional concerns you may have, or do your parents need some linking up to supportive services? And in the adult clinic, we're asking about those social connections, and do you need opportunities and information about how to find some of those social connections in our community? Oftentimes we do find that the children we're seeing do have some emotional, anxiety, ADHD concerns that are coming up. So whenever those things are coming up in clinic, we are happy to help with making recommendations and referrals within Children's or to community-based providers. My role often is some families are traveling quite some ways to come to us, and I'm looking and helping them find connections to these kinds of supports and services in their home community as well. And then, so when we transition you, often we transition you to adult movement clinic. So adult movement clinic is housed still within DDBP. It's just that the providers, many of the same providers, but then some of the providers do not come. So transition medicine, Dr. Woodward comes, Katie Thoman is still there as the nurse practitioner, Dr. McMahon and Dr. Bolger come to staff for rehab. There is social work, and there is more of a connection to a vocation education specialist within the hospital who's really going to be working, making sure everybody is having that opportunity for post-secondary education or work experience, kind of whatever the goal is. So just like the Center for the Children, this is not a primary care physician's office. So still need a primary care doctor in the community, but this team is working to support as much community involvement as possible. And they still do try to coordinate and make sure that everyone's following up with their adult neurosurgeon, that they've got their urology connections, that they're still in contact with their brace shop folks. So they're still working on some of that coordination. But as you can see, they have less supports. So it does become more of the onus of the individual to help us know what you need once you move into adult movement clinic.
So we also want to just address mental health supports. As Marta mentioned, there can be some additional social and emotional concerns that can happen really with anyone in the general public, but when you add co-occurring diagnoses, it can really complicate the picture of what's happening on a holistic perspective. So there's a lot of supports that are available, and we just want to make note of some opportunities for you to access those. Definitely first start is to be talking to your team. So if you're connected to the Spina Bifida Clinic, you can raise those within your appointments there. But then in terms of where to access supports, there's a lot of different opportunities in Ohio. There's school-based services. So a lot of the schools in the Cincinnati area in particular have partnerships with school-based mental health agencies. So you can receive mental health supports right there during the school day or on the school campus, whether that's before school, after school, lunchtime. I know that they make a big effort not to pull out of school during that academic time, but it's also a benefit in that if there's something that happens during the school day, they're right there on site to be able to be responsive and supportive during that need. There's also agencies that provide home-based support. So especially for people who have limited transportation or just, it's complicated to juggle schedules and get from here to there, it's a lot easier to be providing support in the home. And it's beneficial on the side of being able to see the person in the home environment as well in terms of the therapeutic response. And then there's also, of course, center-based treatment where you can go to an agency providing mental health therapy supports. So I've got, we plugged in a link here for MindPeace Cincinnati, which has a nice provider resource library. If you click on that link, you can type in the specifics in terms of, do you want a male or a female provider? Which part of town do you live in? What's your health insurance? Is it Medicaid or private insurance with United or Anthem or whomever? And it'll help to narrow down a list of options that are available. You can even plug in some specific needs. So for example, if anxiety is a big need, you can find a provider who specializes in anxiety or depression or certain types of treatment in response to the diagnosis. And then finally, just to know that there are some info sheets again on the Spina Bifida Association website, which can help to address how that co-occurring need of anxiety or depression or whatever the mental health need may be can look in terms of having spina bifida as well. And then we finally want to just make sure that for those parents that are on the webinar, that you're taking the time to take care of yourself too. For the caregiver, really, it doesn't matter if you're a parent or whomever you may be. The caregiver needs to take care of themselves in order to really provide effective care. So it's complicated to live this life and try to figure out all of these many resources that we've talked about tonight. And I'm sure that there are tons that we didn't touch on tonight that are still out there and will continue to grow in the community. There's always something new that's happening. So that can be really complicated and frustrating to try to navigate the systems and supports that are out there. So if you're not taking care of yourself, it really makes it even more complicated. So do what you can to take care of you, find the things that you need to do for your downtime and what makes you happy so that you can be the best caregiver that you can and access these really complicated and difficult systems that we have out here. So we want to thank you for being here tonight with us. Thank you, Diane, for having us and for Marta and I to be able to provide what we know in terms of resources. If you have additional questions, we've got our contact information listed here. I'm really good at also saying, I don't know, but I can find out for you. So that's definitely how Marta and I work together most, is my saying, I got a question, Marta, and I bring it to her and she can connect me with another resource as well. So feel free to reach out to either one of us or both of us as other things come up, whether that's quickly or later on down the road. Feel free to use us as a resource. So we will go ahead and open it up to questions at this point.
All right, we want to thank you for sharing this wonderful information with us about all the resources available to assist families living with spina bifida in Greater Cincinnati. During the presentation, we did have several questions. Remember, you still have time to submit your question through the question pane in your attendee control panel as long as we are live. The first question came in with, will my early intervention specialist help me know how and where I should register my child for preschool where they have experience with catheterization and don't expect him to be out of diapers yet because of his neurogenic bladder?
Well, My answer to that, Marta, you chime in as well, would be that Help Me Grow will be able to provide a list of resources and to be able to connect you to potential people. However, each program is going to be what they are. And so there are some who have had really good experiences and can handle some really complicated situations. And some who will say that they are until they're in it and then realize that it's a bit more complicated than they even realize it to be. I would say as those kinds of needs arise and as difficulties arise, no matter what preschool that you may be connected to raise it with your team. So if Help Me Grow is part of that, then take your current concerns and questions to them, and think about that with the school as a team, to really address the needs, because it may be an educational side of helping them to better understand the need and how they should be responsive to it, and then they can step up and be that appropriate provider. In terms of finding one specific preschool who says they can and actually does, I think that it's complicated, and it's hard for anybody to say, here's a recommendation of the best. So.
And also with Help Me Grow, though, part of that evaluation will be with your public preschool. So if your child qualifies for an IEP in the public preschool, then the school district will be responsible for meeting their needs when they're in the building. Preschool can be complicated because often preschool is only a part-day program, both in the public schools and private preschools. And so due to that, it's okay to talk to us as your medical team. Sometimes that means the cathing may occur an hour late, and you might find that if things are going all right, urology will say, that's okay, we can skip doing catheterizations during preschool if that's going to be something that's complicating to preschool. I will tell you that we've had our nurse coordinators have gone to different daycare centers in the community and helped with cath teaching. So we have had many kids who are in daycare who require catheterizations during the day. When the nurse coordinators go, the parent is the person performing the cath, and the nurse is just overseeing it and there to answer any questions for the daycare staff. And sometimes the daycare just needs something kind of signed off on that somebody was there, the staff learned it, and then they're able to take it from there. So once in school will be responsible in ensuring that there's somebody there to provide the cath during the day. But this issue does come up with young children in daycare as well.
Okay, question number 2. What exactly does guardianship mean, and how do we put this in place if we decide it is appropriate for an adult child with spina bifida?
So guardianship, taking guardianship means that there is someone else who's making decisions for the adult with a disability. So it's a legal process in order to apply for that. You can begin that about 6 months before the age of 18, but no sooner in terms of filling out the paperwork, and then anytime after the age of 18. The application is completed and then it goes through the legal system in order to determine if guardianship is in fact deemed necessary for the person. So they want to take a look at, is this person capable of making decisions on their own, and is it in the best interest of the person to have somebody making decisions for them or not? So if it's deemed appropriate for somebody else to be guardian, then that means that healthcare decisions, if the person is still in school, the school team, in terms of IEPs or any other formal paperwork that needs to be signed off, is done by that appointed guardian. Oftentimes a family will be the person who is appointed as guardian, but if that's not appropriate for whatever reason, or there isn't someone who's available, then there are state appointed guardians who can be that person who makes those decisions. And there's a couple organizations such as APSI in the state of Ohio that can serve as that guardian for the person.
And the process of applying for guardianship is different in every state. So in Ohio, you go to your county probate court and you can get the packet, and there's a couple of pages that need to be filled out either by a medical doctor or a psychologist. as a statement of expert evaluation. In Kentucky, the process is different. In Indiana, the process is different. The requirements are different. The court fees are different. In the state of Ohio, if you are applying for guardianship and the cost of the court fees is difficult for you, you just need to let the probate court know that when you're filing your petition.
Okay, question number 3. Do I have to qualify for SSI in order to get waiver services?
So those are two separate systems. If you take a look at the financial handout, we have a link for and contact information for both of those systems. So Social Security is a national system that you would want to check for eligibility for, and then your DD services are going to be county. So in terms of qualifying for eligibility, then you'd want to go through those two separate systems, and the two are not tied together. So you may qualify for one and not the other, or you may qualify for both.
Okay, question number 4. If I have insurance through my employer, can I still qualify for Medicaid as a secondary insurance to help with the cost of co-pays and cover items my primary insurance denies?
It is possible to be working and still qualify income-wise for Medicaid. You just would have to apply at your county in Ohio, at your county Job and Family Services office for the Medicaid. Again, there is that financial resource that has the specific information about how much money you can be making per month and still qualify for Medicaid as an adult or as a family. So it is possible.
Okay, question number 5. What happens to my Social Security and Medicaid benefits if I get married?
So if you get married, then it's kind of like when you're a kid and you're living at home, and we said they look at your household income and the size. So when you get married, it will look at the household income and size. So if your spouse is working or receiving income in the form of Social Security, him or herself, that income will be counted. So you will need to report that new income to SSI and Medicaid for them to do another evaluation to ensure that you still qualify. So it's possible that once you get married, if there's income between both of you, that you could lose your Medicaid and your SSI benefits. So something to kind of think about and look at before possibly making that decision. So.
Okay, number 6. I am 30 years old and have never had a case manager through DDS. Can I still apply now that I'm living on my own and really need support?
Yes, so in terms of eligibility for DDS, there's different age time criteria that they look at for eligibility. And so if you're over 16, there's an different set of criteria that they're going to be looking at. The big piece is wanting to see that the diagnosis was there prior to the age of 12. So as long as there's some documentation, and of course through health history, there should be plenty of things that can be provided to developmental disability services in order to show justification that the diagnosis of spina bifida would qualify for developmental disability services. And then once that happens, they'll take and you qualify for DDS, making that assumption, then they'll take a look at what services might be appropriate for you over the age of 30. So, yeah, and things change over time. So that's why when we talked about DDS, it's a good idea to get connected early on, even if you're not going to be thinking about connecting to services. Then that way you can reach out to your appointed person, and as things change over time, you can be looking at what services might be appropriate over time. So absolutely, never too late to be thinking about what might be available.
Okay, and finally, if I'm employed, let me start that again, sorry. If I'm an employed adult with insurance, but due to a health situation, like a pressure wound, I'm unable to work for 6 months or more, do I qualify for Medicaid and SSI for a limited period until I can get back to work?
So, if you are not receiving income because you're off of work, then it is possible that you might qualify for Medicaid. Medicaid is looking at your current income right now, And so they're going to have you submit your past 30 days of pay stubs and that kind of stuff. So if you're not getting paid, or if you're being paid on a reduced level, if you're only getting 50% of pay while you're out with your wound, it is possible that you may then income qualify for Medicaid. If you're going to be out of work for more than a year, you can, and you have been in the workforce, then you have paid into Social Security disability, so SSDI. And if you're going to be out of work for more than a year, then your claim would actually be for SSDI and not SSI. And then your payout is a percentage of what you've paid into the system because you've been employed and you've been paying into that system. So all of that can get a bit complicated. So if you do have like a DDS worker, that's something they can help you with, because then insurance, if you get SSDI, then insurance also gets complicated again because you might then qualify for Medicare instead of Medicaid, which is even more confusing. So if you have a support person who is familiar with these systems, it's definitely a time when you want to pull them in and say, what am I supposed to be doing? But yes, you could possibly qualify for Medicaid or Medicare and SSDI.
Okay, I was wrong. We have one more. Rhonda wants to know, if I choose to send my child to a parochial school, is the IEP process different from the public school system?
So we were actually just talking about this before the webinar started. In most parochial schools, the IEP is still followed. It's really going to depend on the parochial school that you're in terms of the supports and services that they have on site. Some have parochial schools, some have pretty robust services that they have either contracted with or that they can provide there on site. But the IEP, in terms of making a decision, the IEP is certainly still something that can be followed within the school, the parochial school as well. It's definitely a conversation you want to have as you're thinking about that transition. Talk with the school that you've identified and, have your IEP with you to be thinking about what all are they able to do, because going to a parochial school does mean that it's the free and appropriate public education is waived by being in a parochial school. So there are points of that they may say they can't do because of their location. So something to certainly think about and a good question to be asking as you think about making that move.
Okay, this is Diane back on. Thank you, Marta and Ann, for helping us understand what resources are available and how and when we qualify for services. In addition, thanks everyone for attending today's webinar, Navigating the Maze of Resources. If you have any other questions, please email me at dburns@sbccincy.org. On behalf of the Spina Bifida Coalition of Cincinnati, our presenters from Cincinnati Children's Hospital and the Regional Autism Advisory Council and the Hatton Foundation, we thank you for joining us. Now go create your future.